When you pick up the heart, this arch here is the aortic arch, and that's on the anterior side, so this is the anterior side of the heart. To the left, you have the right ventricle, or the right atrium, sorry, and underneath that is the right ventricle. Over here is the left atrium and the left ventricle. When blood enters the heart, it enters from the body through the superior and inferior vena cavas, and that pours into the right atrium. Inside the right atrium, you can see the fossa ovalis here, and here you can see the pectinate muscles. If you close the right atrium, you can see the right auricle. Blood flows from the right atrium into the left, or the right ventricle, and inside the right ventricle, you can see the trabeculae carnae muscles, and these large ones here are papillary muscles. And from here, the blood flows up here, which is the conus arteriosus, into the pulmonary trunk. The pulmonary trunk branches into the pulmonary arteries. Here is the left pulmonary artery, and over here is the right pulmonary artery. Those flow to the lungs, where the blood becomes oxygenated, and then the blood flows back through the pulmonary veins, which are here. These are the left pulmonary veins and the right pulmonary veins. From there, it enters the left atrium and then the left ventricle, and it enters the aorta, and it's pumped out to the body from the aorta, and that's oxygenated blood.
Now, the part that separates the atria from the ventricles here is known as the coronary sulcus. Kind of forms a ring around it. And if you open up the heart, the part that serves as a dividing wall between the left and right halves is known as the coronary septum. Now, the heart also utilizes several valves to assist with blood flow. From the left atrium to the left ventricle here is the bicuspid valve, and from the right atrium to the right ventricle is the tricuspid valve, and in between that are the chordae tendineae, which are held up by papillary muscles. Along with the atrioventricular valves, there are also semilunar valves. If you go from the left ventricle here to the aorta, you can see the aortic valve, and if you go from the right ventricle to the pulmonary trunk, you can see the pulmonary valve. And the heart itself also has individual layers, with the outer layer being the pericardium, the inner layer being the endocardium, and the layer in between being the myocardium.
The heart also has several blood vessels that provide blood to the cardiac muscle itself. We'll start with the arteries, which are oxygenated. So peeking out from behind the pulmonary trunk, you have the left coronary artery, which branches into the circumflex branch and the anterior interventricular branch. If you move the right auricle, you have the right coronary artery, which branches into the marginal branch here, and also the posterior interventricular branch here. There are also veins, which are easiest to identify if you start with the coronary sinus on the posterior side of the heart. So this is the coronary sinus, it's very large. And if you move this way, you have the middle cardiac vein. Over here is the small cardiac vein. These are the anterior cardiac veins. And if you go back to the coronary sinus and move this way, you have the great cardiac vein. And that's the heart.